I'm Brian Stanley. I'm with Creative Treatment Options. We're an outpatient behavioral health care provider, mainly focused on SUD. We have about 1,000 active clients that we treat primarily for SUD, also some domestic violence. We are offering a pretty wide range of services from domestic violence to SUD, and we're working a lot with the primary care community trying to really capitalize on medication-assisted treatment. And one of the things that I think is really important about that, I've talked to a number of people in OBH and Medicaid, et cetera, about this, but it seems to me that there's an assumption with medication-assisted treatment for SUD that it's the primary care providers who really kind of start that off. A person will go to their primary care provider with their issue. The primary care provider will do a diagnosis. If it's appropriate, then they'll start the medications. It turns out that's hardly ever true. Most people do not go to their primary care physicians for this kind of issue. So this is like 2 years worth of experience that we've had with this. They go somewhere else or to some other primary care physician. It's kind of a privacy stigma issue, number one. Number two, we know that 1,000 providers have been waivered, the X waiver, which means they can prescribe the opioid treatments. But according to Mark Condagione from OBH, there's only about 9 patients per of one of those thousands. We've been working collaboratively with a couple of primary care providers for about 2 years now, and we've seen about 150 clients collaboratively. But only 20 of those have come from primary care, so it's roughly a 8 or 9 or 10 to 1 that's coming in through outpatient. So human services, child welfare services, criminal justice system, corrections, that's where the volume of people are coming in. So we're referring all of our clients to primary care. So it's probably, like I said, about 8 or 10 to 1 of outpatient care going into primary care. And then the medications happen and the MAT occurs. The opposite is just not happening at all. Very few people are doing anything more than the medications. The perception is that once they're on the medications and the usage goes down and the craving stops, the problem is solved. But we know with addictions, prior to that, there's all kinds of lifestyle and family and employment and trust issues that come from that. So our concern is medication-assisted treatment is really turning into medication. And the proper diagnosis, where there's a medical diagnosis of SUD and a behavioral diagnosis of SUD, those are really not getting the T part of MAT. And we really don't know how to approach that. It seems to be pretty prevalent. We're on a number of the workforce from the consortium and working with OBH a lot, and we're going to the Medicaid meetings. We're in CCHA's region 6 and 7, and we're also in Colorado Access's regions. So again, we have about 1,000 active clients. Probably 700 of those are Medicaid in the Denver metro area, and 150 are primary care, working collaboratively with primary care. We've probably got 250 that are under CCHA, so we'll be talking to them about their issues. So that's really got what I think is kind of an important piece of news about really getting medication-assisted treatment kind of put together, right? So we're looking to help in any way we can to try to lend this kind of news to whoever will listen. Jefferson County Public Health, Michael Miller, their newer guy there, we're in tune with him. We're working with that. We're hoping to do some events with them. But this is just a small fraction. So I think that's my main piece of news.
Wait again, what organization are you with?
Creative Treatment Options. We've been doing SUD for 21 years. This is our 21st year. Founded in '98 in Arvada. So we're in Arvada, Lakewood, and Commerce City, 3 locations.
All right, thank you. I'm glad we stopped
Thank you.
to listen.